All right, well, we'll go ahead and get started. Good afternoon, everybody, and thanks for joining us for today's briefing. Today we have Dr. Sarah Nafziger, Vice President of Clinical Support Services with the UAB Health System. Today she'll be discussing the current state of COVID at UAB Hospital, the surge that emergency departments at UAB are seeing as COVID cases rise in our community, and other questions you might have. We are streaming live on our UAB Facebook page as well. And for the media, we will provide a recording shortly following the end of our question and answer session. Dr. Nafziger, we can go ahead and jump into a couple of questions we had submitted beforehand. And then as you get going, media can ask their questions as well, either through the chat or using the raise hand function. So Dr. Nafziger, the first question we have, are Omicron symptoms different than Delta or the original COVID strain, and what are doctors at UAB seeing currently?
You know, that's a really good question. Omicron looks a little bit different than what we've seen in the past with Delta and some of the other strains that we've experienced. With Omicron, it tends to be more like what we call a head cold more than a chest cold. I know, you know, that's probably how a lot of us, our grandmothers talk to us, but that's kind of how I like to think of it. With Omicron, a lot of the symptoms are more sneezing, congestion, runny nose, things like that. And with Delta, what we saw was more cough, a lot more fevers with that. Not to say, I mean, you could still have all those symptoms with any of the variants, but with Omicron, what we're seeing is it tends to be a little more in your head and those type symptoms. We're not seeing as many people complain of losing their sense of smell or their sense of taste. So if you're one of those people who's waiting for that to happen to decide whether or not you have COVID, then you're out of luck with this variant because it doesn't always cause that. And that's great news. You know, the other good news is with Omicron, it seems like it's not quite as severe. Most of the cases that we're seeing, people are not quite as ill with this variant. However, we do know that there's a lot of Delta variants still out there, and we are seeing some people who are still getting very ill, requiring hospitalization and critical care, and people are still dying from COVID. So, you know, it's just kind of hard to say which one you're going to be exposed to and which one you get. But with Omicron, it's tending to look a little milder, and that's the really good news that we have today.
All right, thank you. Waiting on a couple of questions to come in.
Hey, Adam, while you're waiting on that, let me add a couple of things I should have said just now.
Sure.
One other thing I forgot to mention we're seeing a lot of with Omicron is we're seeing a lot of people complain with a sore throat and with a headache. I should have mentioned that. That's something that we're seeing a lot of people complain of. Seems to be more prominent than with past surges. So those are a couple of other things to look for. And, you know, a lot of people have asked me, how can you tell if you've got a cold or if you've got COVID? And the bottom line is you really can't tell without having a test done. So that's why getting a test if you have symptoms is so important.
All right, thank you. What should folks do if symptoms do appear?
Yeah, so if you have symptoms, there's a couple things you need to do. First of all, is you need to isolate yourself, get away from people, because you don't want to spread. If you have symptoms, if you have COVID, you don't want to spread it around. And, you know, even if it ends up not being COVID, you don't want to spread around whatever it is that you have. So if you have symptoms, first thing is isolate yourself. You know, put on a mask, social distance, those type of things. The second thing is you want to get tested. You want to find out whether or not you have it, because knowledge is power. You need to know whether or not you have COVID or not. So that's the simple things that you need to do. And then if you have a positive test, then you're going to need to isolate for the recommended time periods. But the first thing you got to do is figure out whether or not it's COVID. And guess what? You can't tell if you don't take a test.
All right, thank you. Next question comes from Marcus Cooper. You may be able to speak more about UAB's experience, but how are state or hospitals like UAB handling hospitalizations so far?
So the thing that's a little bit different with this surge is while the cases in the community are just absolutely skyrocketing, our hospitalizations, while they're increasing, they're not skyrocketing at the same pace we've seen with other surges. They're increasing, but not as quickly. So right now at UAB Hospital, We have a lot of patients who have COVID, and we have patients admitted just because they have COVID. But we have a lot of patients who are being admitted for other things who also happen to have COVID and have very mild symptoms or no symptoms at all. For example, we have patients who've experienced trauma due to different things who are being admitted. And when we test them on admission, oh, by the way, your COVID test is positive, but you're being admitted to the hospital because of some other reason. So we're seeing a little bit more of that with this surge. So the number of patients that we have hospitalized with COVID in itself, it is putting a strain on our resources, but it's not anywhere close to the highest numbers we've seen in the past. The thing that's different for us with this surge is the Omicron strain is really putting a strain on our staffing. We're having a lot of staff who are testing positive, who are having to stay out of work because of that, because we can't have them at the hospital spreading around illness if they're COVID positive. So it's really putting a strain on staffing. And with this surge, that's really been more of a strain on us than the number of patients that we're seeing hospitalized with COVID. Now, the number of patients that are being hospitalized with COVID is continuing to climb, and we don't know when that's going to peak or plateau. So, that definitely could become more and more of an issue as we move forward and as we continue to have more staff members who are out because of COVID or who have to take care of a family member who's home with COVID or those types of things. So definitely we're watching it very closely, but we're really pleased that there seem to be that the number of patients who are hospitalized with COVID is not skyrocketing as quickly as the cases are in the community. That's the good news that we're holding on to today.
Thank you. The next question is from Morgan Hightower with WBRC. She asks, if Omicron is less severe, are most patients hospitalized at UAB now sick with Delta? Are you doing sequenced testing of patients?
Boy, that's a great question too. So the supplies that are required to do sequencing have been in a little bit short supply. And so prior to the holidays, we were able to do a run of sequencing and saw that almost half of the samples that we had at that time were Omicron. So it was about half and half roughly. And the guidance that we had from the CDC and all the experts said, we anticipate as Omicron kind of comes in and takes over more, we're going to see that Omicron edges Delta out almost completely. Now, since then, the CDC has come back and said, hey, maybe that didn't happen as fast as we thought. And we think there's probably still some Delta circulating in the community. And that's consistent with what we're seeing clinically, because we still see some people with disease that looks more like Delta. We have not had a sequencing run since the holiday that's been completed at our hospital, but we will have that later in the week this week. So when we have that, certainly we're happy to share that information, but I just don't have an updated sequencing run since right before the holiday.
All right, thank you. The next question is from Ian Wrights with WVTM. He asks, based on the case numbers we are seeing and the percent positivity rate, what do you anticipate the next few weeks will look like in Central Alabama?
Oh, goodness. Nobody has a crystal ball, but let me tell you what we're seeing right now. If you look at all the curves, is we're seeing that line go straight up. And it has not slowed down at all in our community. Community transmission is just spreading like wildfire right now. I think our percent positivity rate for Jefferson County, I looked at it this morning and it was almost 40%. So of everybody we test, 40% of those tests are coming back positive. And just the number of people in our community who are testing positive right now is a tremendous number. All the projections that we have from the experts, the epidemiologists, the people who study these things for a living, what they've done is they've learned from the Omicron surge in South Africa and Great Britain. And based on what they're seeing there, they're predicting that we will not peak until later in January. Some say mid-January, some say a little later in January. So it's hard to know exactly when. So if they're accurate, and frankly, they've been very accurate over the last several months as they've learned how to predict better what's going to happen with these surges, then our community cases are going to continue to skyrocket for at least a couple more weeks. And that's going to in turn result in more and more hospitalizations and more strain on staffing, not only for the healthcare systems, but for everyone. And, if you're like me, I've experienced the problems related to staffing, not just in the healthcare system, but in things like going to my favorite restaurant and their hours be limited or them be closed because of staffing concerns. I've had, package shipments delayed because they didn't have enough people to work at the warehouses or had delivery drivers out or other reasons. So, healthcare is not the only industry that is being impacted by community transmission right now. We know that everyone is suffering and everyone is hurting right now. So it just absolutely breaks my heart to see that. I think we're all going to have to exercise a lot of patience with one another over the next few weeks, because we can anticipate that, there are going to be delays. People are working short-staffed. People are doing the best they can with limited resources right now. And I think we're all going to have to give each other some grace. Yeah, that's definitely what I expect to happen over the next couple of weeks. I hope that we peak sooner than that. I hope we can slow this thing down, but right now it seems to be a wildfire out of control.
Thank you. The next question comes from Ramsey Archibald. Do vaccines offer protection from Omicron, more than just protection from infection, but protection from serious disease and hospitalization?
So based on the information we have so far, yes, it looks like vaccines continue to provide some protection to even Omicron variant. The most important protection we get from vaccines is protection from death, protection from ending up in the hospital and having severe illness. So those are the big whammies that we want to avoid, right? But the vaccines also help prevent just infection at all, even mild infection. Now we know that after you've had your vaccine for a while, that immunity does wane, and we see what we call breakthrough infections. So people who've been vaccinated more than 6 months ago, we know that those people, we are seeing breakthrough infections in those individuals. There are a lot of our UAB employees who have been vaccinated a long time ago, and we're seeing them have cases of COVID now. The good news is, though, that almost all of those are very mild. Many of them have no symptoms at all. A lot of them have very mild symptoms, or it's like a cold. Some say maybe even a mild case of the flu, but the vast majority of them have very mild symptoms. There's a small subset of people that we know vaccine does not work well for. Those are people who have an immune system that doesn't function normally. That could be to a disease that they have or to a medication that they're required to take. So some examples of that are people who have a kidney transplant, a liver transplant, a heart transplant, people who are on chemotherapy for treatment for cancer or on some other types of medications. So for those people, those are the ones who I worry about, because we know that the vaccine is not going to work as well for those people. And they're likely to have much more severe outcomes if they catch COVID. So those are the ones that I really worry about a lot. And that's the reason we encourage everyone to get vaccinated, because if we can slow these things down, if we can decrease community transmission, then hopefully we can put this thing out. And those people who are so very vulnerable, we can try to keep them protected by not spreading COVID to them.
All right, thank you. Can you explain what the new CDC guidelines are for those that have been exposed, tested positive, or are experiencing symptoms?
It seems that following the new guidelines is something that takes a lot of time and effort. And I know as somebody, this is my job and what I do, and I get confused with it sometimes as well. So I'm going to go ahead and be honest about that with everybody. It is confusing, it's complicated, and it's so frustrating. I know I'm frustrated, and if I am, I know everybody else is as well. It seems that we're getting a different message and different guidance every day or every week. And I know it can be really frustrating. But here's kind of the bottom line right now, and kind of the way that I like to think about it is, if you test positive for COVID, you need to stay home until you're better, a minimum of 5 days. So if you're at 5 days after you test positive, if you have no symptoms whatsoever and you have a normal immune system, then the CDC now says that it's okay for you to leave your house, for you to go about your business, but they do encourage you to continue to wear a mask just in case on the off chance that you could still be contagious. Because what we know is that if you've still got symptoms, that's the biggest indicator that you're still contagious. So yeah, I mean, a lot of people have said we should retest people before they're allowed to leave their home isolation. But frankly, the thing that's going to be much more accurate is going by those symptoms. So that's really the biggest thing. Now, what if you're exposed? Lord, what should I do if I'm exposed? And I know there are a lot of different guidance out there that has to do with your vaccine, when you received it and the timing of that and what brand. But I'm going to tell you the biggest thing to do if you're exposed, especially if you've been vaccinated, is just to monitor yourself for symptoms. You're going to want to be careful. You're going to want to be considerate and maybe wear that mask and be a little more careful about it, because you don't want to accidentally have a case of COVID and infect other people. The second thing is, if you're exposed, you want to monitor yourself really closely. And we still recommend that you be tested 3 to 5 days after that exposure. So whether or not you get symptoms, we still recommend that you be tested 3 to 5 days after that exposure. So, it's just some basic things that haven't changed. It's try not to spread germs around. Try to be careful about washing your hands. Don't sneeze or cough on other people. Wear a mask. The basic things that we've been talking about throughout the whole pandemic. Those are the things that people still need to remember.
Thank you. Another question from Ramsey Archibald. Is it possible to have Delta and Omicron at the same time? Does one protect from the other post-infection?
Boy, that's a tough question. I don't know the answer to that one. I'm going to tell you, I don't know if you can have them both at the same time. I guess it's possible theoretically, but I really don't know the answer to that. But we do have a little bit of data that suggests that infection with either one, either with Delta or Omicron, does lend a little bit of some immunity to the other moving forward. So that's what we're hopeful. We hope that there is some natural immunity from people who have an infection. We don't know how to quantify that. And scientists don't know how long that will last. So those are things that frankly are just unknown at this point. But we do know that at least in the short term, if you have caught one, it does give you some protection and immunity moving forward for the other. Now, what's that going to look like 6 months from now, 6 weeks from now? Nobody knows. It's too early. So we're just going to have to wait and see.
All right. Next question is from Chastity Maxey. We've been hearing so much about breakthrough cases with people who are fully vaccinated and boosted. What is the message to people, especially those who don't want to get vaccinated or boosted because they believe they'll get the virus anyway? What should people be doing?
Here's the most important thing that I would say to someone who's unvaccinated. And I have friends who are, unvaccinated who've held out and they've had concerns and, they said, gosh, it's just too new. I'm worried about it. And here's what I would tell them is, if you had the opportunity to be in the hospital, to see these people who were like you, who had concerns about the vaccine, who decided to wait, and then they caught COVID and they ended up fighting for their life. If you saw what that looked like, I think that would change your mind for most people, because it's awful, it's terrible, it's lonely. These people, their lives are just absolutely, put on pause, destroyed. And the ones who are lucky enough to survive, it's a long uphill battle coming back from it. And some of them don't make it. I've had good friends of mine, people that I knew from high school, who didn't survive, who wish they had gotten the vaccine, and their families wish they had gotten it. So what I would say, to people who have waited is, please don't wait. Please consider going ahead and getting that vaccine, because we have really good data to show two things. One, that the vaccines are really safe. And number two, that they prevent you from dying. They prevent hospitalization and all that severe illness that goes along with it. So I would just plead with you to consider getting your vaccine if you've not done so already.
All right, thank you. Next question is from Ian Wrights. He says, because of this surge, what is your best guidance for schools and or for families with those too young to get vaccinated?
Whew. Well, I'm glad you asked an easy question. That is a really difficult question. And I'm going to tell you, I'm answering this both with the bias that, I'm a mother too. I have children at home and I understand the importance of them going to school, of them being together, of them continuing their education. Their lives have been disrupted so much in the last 2 years that I can't even begin to fathom what that impact that's going to have on them moving forward. Having said that, I do think it's important for us to get them in school if we can. I think it's important for us to do that, though, safely. Right now, the way the data is looking, with rampant community spread, I'm concerned about school starting back. I'm concerned about what that's going to do in our community and about how the cases are going to look. I'm concerned about how that's going to spread, particularly among children who are too young to get vaccinated. So I think those are very difficult decisions. I am so grateful that I'm not the person who has to make those decisions as a school administrator, because I think they're very difficult. You have to weigh a lot of the risk and benefit there. I know that there are a lot of downsides to keeping the children out of school. And I know that if we can mask, if we can social distance, if we can have people who are vaccinated, those are ways that we can be together safely. So my hope and prayer is that people really think about doing the things that we know that can keep us safe, about getting vaccinated if you're eligible. Think about wearing a mask when people gather together, and think about trying to social distance in situations where we can. If people will stay home when they're sick, those I think are the tickets to us being able to live our lives normally over the next few weeks. I have serious doubts that we'll be able to continue to do that over the next couple of weeks, but who knows what's going to happen. I don't have a crystal ball and nobody else does. We can't predict the future, but looking at the science and what we're seeing with the community spread right now, I have serious concerns about our ability to sustain what looks like normal operations for us as a society. So I don't know if we're going to have enough, people to do the things that we normally do. Will there be enough teachers who are well enough for us to be able to have school? Will there be enough bus drivers? Will there be enough cafeteria workers? I just don't know. I don't think any of us know, truthfully. So it's something we're going to have to all watch very closely to see if we're going to be able to have kids in school coming up over the next couple of weeks. I know it's something that I'm going to be watching closely, and probably a lot of us are really kind of waiting with bated breath to see what happens.
Thank you. Next question is from Chastity Maxey. Is breakthrough case a misunderstood term? Because you can still get COVID even if you've been vaccinated and boosted.
Yeah, so when we say a breakthrough case, really what we mean is somebody who's been vaccinated who has a case of COVID. And for us, most of us, I don't think we make the distinction of whether or not you've had a booster when we talk about a breakthrough case. Now, there may be some formal definition somewhere on a CDC website that has a little more detail, but I can tell you, for most of us healthcare providers, when we're saying a breakthrough case, what we're talking about is someone who's previously been vaccinated who subsequently tests positive for COVID.
All right. And in addition to that question, kind of along the same lines, can you, in your experience, are there a high number of false negative tests? And can you explain what a false negative is?
Sure thing. So, all tests are not created equal. And in general, there are kind of two types of tests out there on the market. There's what we call the gold standard, which is a PCR test, which stands for polymerase chain reaction. And those tests tend to be very sensitive. They tend to be accurate. You can usually count on them. In fact, they're almost too sensitive. So those are really good tests. The other type of test on the market is an antigen detection test. And those are typically the ones that are the rapid tests. So most of the time, if you go to the urgent care and can get a test result in 15 minutes, that's the type of test you've had. Most of the time, if you can get a home test kit, it's going to be an antigen test. Now, those tests work really well, but they're really variable in how they perform depending on the manufacturer. So some of them are very accurate and some of them are less accurate. The thing that we know is they're less accurate for people who don't have symptoms. So if you're somebody who has no symptoms whatsoever and you just wanted to take a test and you took an antigen test, well, those tend to be less accurate. But for people who have symptoms who take an antigen test, in those cases, the tests tend to be more accurate. A false negative test would be when you take a test, and it doesn't matter what kind of test, and you actually have COVID, but the test is negative. And so we do see some false negatives from time to time. And it varies what that rate is, depending on the type of test that's used and a few other things. So for example, when you take a test, a lot of times you have to get the swab in the nose and it's really uncomfortable. Well, if you didn't get a good swab sample, maybe somebody who was swabbing you that day wasn't being as aggressive and didn't get a good sample. If you don't get a good sample, the test will be less accurate. So that's an example of a type of thing that can cause a false negative test. But essentially what that means is you took a test, it said you didn't have COVID, but you really do. Now, what is the rate of false negativity? Like I said, it's different for different tests. But if you're taking an antigen test, which is one of those at-home kits, typically those kind of tests work better if you're a person who actually has symptoms. That makes them much more accurate.
Thank you for that clarification. Another question from Morgan Hightower: is UAB still administering monoclonal antibody treatments? I understand there's one therapy that works for Omicron, but it's in short supply. But with Delta still circulating, is UAB administering the other therapies that worked well against that strain?
So this is the treatments for COVID is something that has changed minute to minute. And even this morning, this is something that's changed that we've been working on at the hospital to adapt to the guidance that's out there. So the monoclonal antibody therapies have been really our best tool to keep people who are super high risk out of the hospital. So it's people who've already caught COVID and they have high risk conditions, and we're worried they're going to end up in the hospital. So we can give them this treatment so that we keep them from ending up in the hospital. And it's been a great tool. That's something we've been doing for months now. So what we learned is the monoclonal antibody product that we have been using through the Delta surge, well, guess what? It doesn't work for Omicron. And so the CDC kind of predicted, and everybody thought that Omicron was going to completely take over and we wouldn't be seeing a lot of Delta by this point. So the FDA came out and said, hey, stop using this product. It's not working for Omicron. We're wasting our time. Let's focus on other things. There's this new product that's coming out and let's use it instead. Well, the new product hasn't arrived to Alabama yet. It's still out there. And in the meantime, the CDC figured out that, hey, we still got some Delta out there in the community. So guess what? Go ahead and keep using the older product for now until we get this newer product in that works for Omicron. So we are still working to digest that information. Just came out today with new guidance. And so right now the experts at UAB are really considering whether or not they want to reopen our monoclonal antibody infusion clinic with this older product right now, based on what we're seeing in our community, trying to figure out whether or not that will be worth the time and effort in trying to treat those patients, or whether we should focus on other things like the newer product of monoclonal antibody. So we're trying to figure out when we might get that. So a lot of things moving parts with that. So stay tuned, because we'll be making an announcement about that later this week, about that decision for that moving forward. Like I said, this is just something that we've been really hashing through all the data this morning. Now, when we're talking about treatments, there's now another type of treatment in play, as if that wasn't confusing enough, because I know that's like a lot of detail and maybe more than most of you wanted to know. But there's another treatment that's come out, that's become available over the last few days, that's called Paxlovid, which is a pill. And this treatment has been distributed to Alabama, and it's in pharmacies. So that's how they decided to distribute it. And this just happened over the last week. And I believe there are 38 or 39 pharmacies around the state that have received that treatment. And it is a very small number of doses that each one received. And people who can get that, you have to have a doctor's prescription to get it. And once again, it's just like those monoclonal antibodies, it's being reserved for only people who are the most high risk. So people who we're concerned, hey, if you get COVID, this might be really bad for you. You have a lot of risk factors, and we're very concerned that you might end up in the hospital or die from it. So that's who it's being used for. And like I said, this is very, very new. We're just like processing how to prescribe it, who qualifies for it, and all those types of things are things that are being worked out today. But we do know that there are a very small number of doses available in some pharmacies throughout the state. And we are trying to connect our patients to that who need it. So once again, treatment for COVID, very complex stuff, a lot of moving parts and a lot of things that we're trying to process. We want to be as transparent with you in the community as we can about these things. So that's why we're sharing all this detailed information that may be a little bit mind numbing, but wanted to make sure all that information is out there.
Thank you. Question from Ian writes, if you have traveled during the holidays or been around big crowds or family gatherings and don't have symptoms, should you get tested?
Boy, that's a great question. And, you know, I would love to tell everybody that the answer to that is yes. If you have a home test kit, it's probably a good idea. But, you know, that's playing by the rules. If you've had an exposure that you know about, you should get a test. If you haven't had a known exposure, then there's not really a great testing recommendation right now. And I think part of the reason for that is I don't know that we have all the testing infrastructure built in our country to sustain that type of demand, to be quite honest with you. What we've seen over the last couple of weeks is people really struggling to find tests. So right now, you know, I think it's best to reserve testing for people who are symptomatic, people who have had a known exposure. Those are the people who we really want to be tested right now. Over the last couple of weeks, we shared with you that we've had some days when our emergency departments were just overrun with people who essentially had cold symptoms who wanted to get a test for COVID, and they're doing what we ask them to do, right? We say, if you got symptoms, get a test. And they couldn't find a test anywhere. You know, they went to the pharmacies and they couldn't find a home test kit. And a lot of places were closed for the holidays. So really, you know, testing has been something that has been very difficult throughout the entire pandemic for us. I've never felt comfortable that we have enough testing, frankly, throughout the entire pandemic. It'd be great if we had the luxury of everybody could test all the time, but frankly, I think we're still in a position where we really need to focus on people who are symptomatic, people who have had those high risk exposures. Now, you know, there are some testing options available. UAB has our drive-through test site. We've expanded hours for that in response to the increase in demand. I know that a lot of the urgent cares and primary care offices have been able to add point of care testing and different testing resources. And then there's, I know that the pharmacies all over the state are really trying to focus on getting those home test kits in and get them available to people. So I'll say that testing has been difficult. I know that people are struggling with it, and we appreciate everybody trying to do what we recommend when we say, hey, get tested if you have symptoms or an exposure. I acknowledge that that can be difficult to find testing sometimes.
Thank you. Kind of along those lines, if someone tests positive for COVID-19, how do they safely receive a prescription, maybe for that Paxlovid from a doctor?
You know, that's a great question. Right now, my first guidance would be that you need to go through your primary care doctor. That's going to be the best way for people who have an established primary care physician. If you don't have an established primary care physician, I'll tell you right now that the healthcare community is trying to figure this out. You know, the physicians at UAB, we just received the data on this. We're really working out, trying to figure out how to prescribe this for those very high risk individuals who need it. So frankly, the first and best advice is to go through your primary care physician. If you're not terribly ill, there are urgent cares And hopefully they will be able to take care of some of those needs for people who don't have primary care. And then lastly, for people who have true emergencies, if you're really ill, if you've got shortness of breath or severe illness and you need to go to the emergency department, then definitely in those cases go to the emergency department. But I would urge you to not go to the emergency department just because you have COVID and you want a Paxlovid prescription. That's really not the best use of the emergency departments, and we need to make sure those are available for people not only who are having emergency symptoms related to COVID, but for people who are having other emergencies, because people are still having car accidents and strokes and heart attacks and lots of other things. So we need to make sure that we preserve those resources for the people who need them.
Thank you. Just a couple of more and then we'll wrap up. One clarification question for you, Dr. Nafziger. Did UAB close its monoclonal antibody infusion center after FDA guidance said that Regeneron did not work well? Is that correct?
That's correct. As like today, the monoclonal antibody infusion clinic is not open. It's been closed for about a week now, based on that guidance that we should not continue to use the product that we had available. Since this morning, we received guidance that we should resume using that product. So now we're looking at how we could do that and what's the best strategy to make sure that we can care for the greatest number of people with the products that are available. So more to come on that just as soon as we figure that out. I mean, I'd love to talk to you about COVID vaccine supplies as well, because that is something in parallel to that. And we have previously offered COVID vaccine in our drive-through site at the Highlands Hospital parking deck. That was our current status as of last week. But as of today, because we've expanded offerings there for testing to meet that need, we've collapsed down our vaccine sites. And now we have offerings in the Kirkland Clinic for our established patients. And then we have an injection clinic that's open to not only our patients, but to the community as well. And those offerings are still available. As of today, right this moment, we are running a little bit low on vaccines, waiting on new shipment, but we expect that to be coming in any day now. So UABmedicinevaccine.org is the website you can go to if you want to get an appointment, or you can go to vaccinefinder.org to find an appointment if you want to go somewhere that might be more convenient.
All right. Another question. You said that there are patients who tested positive for COVID through routing testing. Are you able to break down how many patients are treated for other reasons and have COVID, and how many are being treated for COVID? And also, with staff getting sick, are these people who were vaccinated and boosted?
Okay, so let me take the first part of that question. So the people in the hospital who just are incidentally found to have COVID, who have been admitted for other reasons, I don't have the exact numbers, but it's creeping up to close to, I think 40% this morning, somewhere along those lines of the patients that we're seeing who have COVID, who are in the hospital, are there for another reason. So an example of that I mentioned earlier was people who may have had a car accident and, oh, by the way, they have COVID. Some of those are people who may be coming in to have a baby and, oh, by the way, they have COVID. So we're seeing more and more of that. And then the second part of that question that has to do with our staff who's out sick, are those breakthrough cases? In many cases, yes, we have a very good vaccination rate among our employees. So we're really happy about that. But many of them who have COVID right now do have what we would term a breakthrough case. They're previously vaccinated and now they have a case of COVID. The good news is most of those are very mild illness. They're essentially at home with a cold. The ones who can work from home, a lot of them are still working from home and doing fine. So that for that, we're very grateful that our employees are not seriously ill for the most part. We're very grateful for that. But yeah, we are seeing breakthrough cases among our employees, just like in the community.
All right. And last question about masking. Are cloth masks still good enough to use with Omicron circulating, would you recommend double masking or some other type of mask?
Yeah, so the CDC has recommended that a cloth mask might not be good enough. There's a lot of data to suggest that we really kind of need to step up our mask game with Omicron because it's more contagious. So, you know, I wear around a lot of times what we call a surgical mask, which is classically kind of what you might see somebody wearing in the past in the operating room at the hospital. But one of those medical grade masks is really kind of what's recommended now. A lot of people ask about, do we need something more significant like a filtering mask, like an N95? And those are typically used when you want to filter the air that you're breathing, so to protect yourself. Um, and the masks that we recommend for most people to wear, the purpose of them is not to filter the air, but it's to prevent the air that you're breathing from spraying particles into the air. So it's what we call source control. So yeah, there's some data to suggest that we might need to step up our mask game, that those thin cloth masks are probably not good enough with Omicron. Probably want to consider more layers is better. And find something a little more substantial than a thin fabric mask would be helpful for most people at this point.
Well, I think that will just about do it for us. Dr. Nafziger, is there anything else you want to make sure we cover today before we conclude?
I just want to close by encouraging people, it's been a long, tough couple of years, and, we are definitely not having fun anymore. This is not fun. It stinks. It's been really hard on everybody, but I'd just like to encourage everyone and say, this is going to end at some point. It's not going to last forever. So hang in there. Let's do what we can to take care of each other. Let's try to prevent the spread of this as much as we can. Love each other, be patient with each other, and have grace with one another, because it's going to be a long few weeks coming up, I'm afraid. And I think we can all get through this together. I wouldn't want to be in any other place in the world other than Alabama and right here at UAB. I'm so grateful to work with the best people in the world and in the best community in the world. So I know we're going to get through this together. And I'd just like to encourage everybody to hang in there. We're going to make it.